when you stand up, all of that fluid and everything, you're gonna swell. First couple weeks, it's actually called swell hell, because you're gonna swell up from all the fluid, all kind of the trauma that we just did to you.
Mm-hmm.
You're gonna come in for your 1 week post-op appointment, and you'll be like, did they do anything to me? And did they take anything off? You're gonna swell up before it's gonna kind of go back to normal, and your recovery. With that, with gravity, everything's gonna kind of go to the pubic area, so that's gonna be pretty swollen as well. So don't be alarmed with that. Also, lumps, bumps, bruising. You're gonna bruise in places that he didn't even touch. That is all normal. All right, gonna probably look pretty beat up at your 1 week post-op appointment, but Kim, the nurse, will say this is all normal stuff as well. All right. I think that was honestly, oh, and then with the garment, with the indentations and stuff, just, this is perfect. This is flowy, loose, just to try to avoid like the tight fitting clothing, because it can leave those indentations as well.
Okay.
All right.
When do I put my apple in? 3 days, he said?
When you stop draining. Yep,
Okay.
so whenever those incisions stop draining, you can start using that.
Okay.
All right, any questions from me, from either one of you?
Mm-mm.
No, and it is normal to have this discomfort. You just had surgery, so. And then I will mention, do you have the phone number for the clinic? I think if you can, I just want, if you have any questions that come up, you can always actually text that phone number. You can send pictures to that phone number. Kim, the nurse, she'll answer with those. You can always call the clinic. We are only open till 6, but there's a hotline staffed with nurses 24/7. So middle of the night, you need to ask a question, our clinic's closed, give this number a call. All right, so if you're having that pain, you can take some more pain medication when you get home. Questions, comments?
She just wants to go home.
Yeah, all right, I'm gonna take that IV out. And I'm sending you home, oh, you taking those Arnicare tablets? Okay, so this is actually Arnicare cream. Go ahead, this is gonna help with bruising. So don't place it right on the incisions or anything like that, it's gonna burn.
Okay.
So especially that big one, don't put on there. Just place it around and where you're seeing the bruising. There are some more Chuck's pads in here. The pads that we have placed on those, you're gonna wanna kinda check those usually every time you get up to walk. All right, and then let me put some more of those emesis bags in here as well for you.
Do you have, I tried to look somewhere on Amazon, they're not coming till Thursday. Do you have a couple of surgical gloves that I could use if I...
Yeah, I can throw a couple in there. Let's see. So these are those, in case she's feeling a little nauseous on the way home.
Just do large, just in case I have to pass it out.
Okay. I'll put a couple pairs. And the garment is crotchless. We didn't put any underwear on you or anything like that. So if you have to go number 2, you'll have to take it off. And it's more of like the actual bra style was that I can't remember what it is, but it's like the 3 hooks. So Kim will go over all this too when you're more awake, but once you swell up and then you start going back down, you'll kind of like move in to kind of make sure it's staying snug. I'll put 3 pairs in here for you, okay?
Thank you.
You're welcome. All right, I'll put them right in here.
Can you put this just in case?
Yeah, I put some more in here, so I'll toss that one for you.
I didn't use it.
Oh, okay, that works. I'm gonna put a couple waters in here for you as well. And then all the information I just went over right in this little packet.
Other than low sodium and carbs, what should I stay away from?
You don't really have to stay away from anything that might thin your blood right now. If he told you kind of stay away from like fish oils, vitamin D, that sort of thing right now, keep staying away. You can resume that, Kim will tell you, after the 1 week post-op appointment.
Okay.
No ibuprofen right now as well, that can thin blood too.
Okay.
Try to keep up with the protein in your diet, that'll help. Alright, I'm gonna give you this. You wanna you can put this other one in there too for you. There you go. Alright, and then let me get everything to take your IV out.
Oh yeah.
And then I'm gonna roll you on out of here, alright?
Thank you.
You're welcome.